Good afternoon. Happy Wednesday, October 20th, and welcome to the Livingston Diversity Council's online learning series, Learn, Love, Livingston, a dive into diversity, advocacy, economy, and empowerment. My name is Nicole Matthews-Creech. I am the Board of Directors Board President for the LDC. I have held that honored position since 2011. Glad to be here with you all today. Although be it virtually, love to be in person rather than, but we can get it all together with us virtually as well. So again, I appreciate all of you being here today. The session is being recorded and will be uploaded to our YouTube channel for further viewing. So feel free to share the link out and check out our YouTube channel afterwards. We've got all of our previously recorded sessions on there as well. So just a few thank yous and acknowledgements before we move into our content for today. My first thank you is to St. Joe's. St. Joseph Mercy Livingston became our Champion for Change partner in January of 2021. So earlier this year, we started our partnership with St. Joe's. St. Joe's not only financially supports the work of the Livingston Diversity Council, but they also are participating in doing the work. So since January 2021, we also do an exchange with our board programming. So we have a member from the St. Joseph Mercy Livingston staff on our board, and then I serve on St. Joseph Mercy Livingston's Diversity and Inclusion Council to assist them in the work that they're doing as well. So we want to thank St. Joe's for the opportunity to continue our programming. A thank you to my Livingston Diversity Council Board of Directors. They're all volunteer. They all do a ton of work, and I could not do what we're doing without them and their support. So I thank our Board of Directors, and a special thanks goes out to our Community Outreach and Education Committee. The work of the council is actually done through 9 subcommittees, 5 of which are community action. And so that involves not only our board members, but members within our Livingston County community to help guide the work that we're doing with regard to diversity, equity, inclusion, and access in Livingston County. So thanks to my committee that helps put together this programming for our online learning series. Just a little bit about the Livingston Diversity Council. If you're not familiar with our organization, we've actually been around since 1987, which is 34 years. Crazy that it's been that long. And our mission, of course, has changed a little bit over the years, but always has focused on really wanting our Livingston County community to be safe and welcoming for all. Our mission and our vision were updated through strategic planning in the 2021 year. And so our mission reads that we are a change agent for diversity, equity, inclusion, and access that collaborates, educates, and empowers to build a thriving community. We all know that we do better when everyone feels included, everyone feels acknowledged, everyone feels valued. The vision of the council is that Livingston County will be a transformative community that embraces and empowers all people for their uniqueness and their contributions. The vision statement is supposed to be when you arrive, right? And we know in this work, we're never going to arrive. We're never going to be fully competent. We're never going to know everything we need to know. So the goal is really just to be transformative and changing, and always getting better and doing better. And that's really the goal of all of the programming. And I appreciate all of you being here today to be a part of that change. Learn more and connect with us. Visit our website if you haven't done so already. Feel free to email us with our email address there. Also, follow us, like us, interact with us on our Facebook and Instagram pages at Livingston Diversity. And then one of our community action committees is Pride Alliance Livingston, which focuses, most of our efforts are focused on the LGBTQ plus community, which is really where this idea for the program today came out of. So I thank my community action committee of Pride Alliance for that as well. Okay, into our topics for today. It's important that when we do our programming, that we also adhere to a group agreement. And it's pretty easy stuff. I think we can all do it. But really all we expect out of everyone today is mutual respect for all participants and for our speakers. Making sure that we mute ourselves, and certainly feel free to use the raise hand function, or there may be times for an open Q&A. Feel free at that time to speak into the space, but we want to make sure that folks are respectful. Attend to privilege. Make sure that when you're asking your questions, when you're making comments, things like that, that we're just aware of the privilege that we are given each individually. Everybody on this call has different privileges. I happen to feel that I have a lot of privileges, being a white, cisgender, straight female. I'm a practicing Christian. I have no disabilities. I am fully able-bodied, right? And so I sit with a lot of privilege, and a lot of my questions and understanding of issues comes from that privilege. So there are things, and a lot of things, that I don't know, and I don't know that I will ever really know, because I haven't had that experience. So that's important to attend to that. Recognize your intent, but also your impact. We know that we're intending on learning, and that's really, really important, but also just keep in mind the impact that it might be having on other folks in the room. That being said, we have to learn. And so sometimes we do have to say things, and we're going to make mistakes, but we can learn to apologize and move forward. Make space, take space. If you are one of those people that always talks, try not to talk. That's really hard for me. For those of you that know me, not surprised by that. But so make sure that you're making space for folks. If you are not one of those people that speaks up, take the opportunity to speak up. Take the opportunity to ask those questions. That's what we're here for today. So take that step out and courageously ask those questions. Avoid freezing people in time, including yourself. We know as we learn more, we oftentimes see the mistakes that we've made in the past, and it's really easy to start just feeling kind of self-loathing and feeling self-doubt and feeling like, wow, I had no idea, and I've made so many mistakes. And that's going to happen as we learn more. So avoid freezing people in time. Know that we've all made mistakes in the past. Know that we can get past them and do better. And that's what we're doing today. And then push your learning edge. Get comfortable with being uncomfortable. That's always the case when we're talking about stuff that we don't know about. And the great thing is that that's where we learn the most, is when we're uncomfortable. So push your learning edge and get comfortable with being uncomfortable. All right. I'm supposed to be done talking. So violence in the closet, understanding the intersection and impact of domestic violence and the LGBTQ plus community is our subject for today. Our facilitators are from LACASA, Kayla Grant and Hannah Smith. Welcome to both of you. Just a little bit of history about both of these two social justice warriors here that are with us today. Kayla Grant is currently the Director of Social Change Advocacy for LACASA. She holds her master's degree in clinical children and family social work. She has spent the last 8 years at LACASA providing prevention and education to youth, support to survivors of interpersonal violence, systems change efforts within the criminal legal system, and awareness in Livingston County residents. She received the Livingston County Prosecutor's Office Above and Beyond Award for her work with Livingston County sexual assault protocols, and has been recognized by the Governor's Office for developing groundbreaking prevention and education programs for Livingston County youth. Kayla leads the social change department at LACASA. She strives to empower professionals, community members, and youth to end domestic violence and sexual assault within our community. So thanks, Kayla. And then we have Hannah Smith. And Hannah Smith is the youth prevention educator and social change advocate at LACASA. Hannah's worked in environmental, human service, and faith-based nonprofit agencies throughout Southeast Michigan for 11 years. Her primary roles have been supporting, organizing, and educating adolescents, adults, community members, and at-risk marginalized populations. Hannah currently works at LACASA, providing community and prevention and education, social change advocacy, and sits on the agency's Diversity, Equity, and Inclusion Committee. Her passions include providing support and education for teenagers and young adults to aid in their autonomy formation and emotional relational health. She holds a bachelor's degree from Spring Arbor University in youth ministry with a focus in psychology and is trained in adolescent mental health first aid. Her speech, mental illness, anxiety, and depression was published by Schoolcraft Community College professor and communications art department chair in a textbook on effective communication. In her free time, Hannah enjoys camping, kayaking, home improvement projects, yay, and spending time with her spouse and her rescue pets. So welcome, Hannah. Thank you both for joining us today. We're so very honored to have you. Here are our learning objectives for today. Hopefully, we will feel very well versed in these as we finish our session today. If not, feel free to ask questions. And I'm sure Hannah and Kayla will be able to provide some follow-up as well. Before I turn it over to Hannah and Kayla, I just want to say to all of you, happy International Pronouns Day. So it is the third Wednesday in October as we celebrate Happy International Pronouns Day. So making sure that we are being respectful of the proper use of pronouns and recognizing the impact when we mispronounce someone or misgender someone. These are important and critical pieces, especially as we move forward with our today's content as well. Without further ado, I'm going to stop talking and I'm going to leave the floor to Kayla and Hannah. Thank you both for being here.
Thank you so much for having us. All right, so hi. All right, can everyone see the PowerPoint? Okay, thumbs up, perfect. Okay, like Nicole had introduced, thank you for that wonderful introduction. You did our whole intro, it's perfect. So my name is Kayla Grant. We are going to be looking at the intersection of domestic violence, interpersonal violence, and the LGBTQ plus community. And we have our learning objectives here, but before we get into that, we do want to acknowledge that this is a difficult topic, specifically talking about violence. So just feel free to take care of yourselves. If you need to keep your camera off, that's perfectly fine. Take breaks if you need to. We completely understand that in discussing this topic, it can be sensitive and sometimes hard to hear and talk about. So Hannah, go ahead and kick us off.
All right, yeah, and as Kayla mentioned, my name is Hannah Bell. My pronouns are she, her, and I kind of want to dive into some of our learning objectives before we really hit into our content. So my hopes and our hopes for today's presentation is that you'll be able to walk away with a basic understanding of these things, some common terms and definitions, a few dynamics which add layers of complexity in domestic violence and interpersonal violent relationships for survivors, especially in the LGBT community, an idea of what survivors may need resource-wise and how it can be difficult for them to connect with these things, ways that you as an individual, part of a group or an agency can support survivors, and then a few local and state resources to tuck into your pocket. But before we really dive into that, I do want to acknowledge a few things. First, our acknowledgement is that we are really scratching the surface. We are talking very broadly about the intersection of domestic violence, interpersonal violence, and the LGBT community. We recognize that there are many other layers in intersecting identities, which can add some complexity and further layers of violence for survivors. This could include race, ethnicity, socioeconomic status, ability, and so much more. So we are just acknowledging that this is scratching the surface. The second thing that we are presenters, we recognize that we only know what we know at this point. We are sharing from our experiences, from what we've learned, the stories that we've heard. We know that so many people have different experiences and much more to add to this work. So just kind of a moment of humility as we don't have all of the answers, but we're going to do our best to share what we can with you. We also know that things change with time. So what we're presenting today, it might be different in 5 years, and it might be different in 10 or 15 or 20. So just that things continue to change. Third, we acknowledge that there is, unfortunately, a history of violence and oppression for the LGBT community and what they have faced. There are limited resources available currently for this community. However, the ones that are available are due to the efforts and contributions of our elders, their bravery and the sacrifices that they made to make these available and accessible and help bring us to where we are today. Our elders are often, I think, forgotten in this, but they have really taken us to where we are, and we're very thankful for that and what they have made accessible. And finally, we want to acknowledge that this is Trans Empowerment Month. That's exciting. That's wonderful. We recognize that our trans siblings face exponentially higher rates of abuse and violence, not only within relationships, but also in daily life and society. We are hoping that this event can kind of serve in a way to share knowledge and educate you and our community and those you know, so that you can continue helping us lift up, amplify, and support the trans community, as well as other members of the LGBT community. I'm going to turn it to Kayla.
All right, thanks, Hannah. So a few things about LACASA, the agency that we're presenting from. LACASA serves really anyone who has been affected by domestic violence, child abuse, or sexual assault. Some things about our agency that people may not know is that all of our services provided to survivors, their friends, and family are provided at no cost or no charge. We are local, so we are currently serving Livingston County, and occasionally we'll serve out of county, and we help any and all victims of abuse. This is something that's, I would say, a little unique to LACASA, and we're going to go over our services later and how we're unique in that way. So we have some common terms and definitions when it comes to really all things we're going to be talking about today. I would also like to acknowledge that we will be using some alphabet soup. So we will be using some acronyms, but we're going to let you know what those acronyms mean before we use them. So let's dive right in. So this definition of domestic violence is taken directly from our Livingston County law enforcement response to domestic violence protocol. And that is domestic violence is an assault or battery committed by an individual in a domestic relationship. So really in this definition, we see more extreme violence, so bodily injury, sexual assault within a relationship, stalking, strangulation. But I really want to acknowledge that a lot of the time there is an intersection with emotional abuse. And we're going to be really focusing on emotional abuse and coercion when we talk about dynamics of abuse, but we did want to share this definition with you and who it affects. So spouses or former spouses, people who have a child in common, living together or have lived together, in dating or have had a dating relationship. So when we say DV, we're talking about domestic violence, and then you might hear IPV, which is intimate partner violence. And so this is a pattern of assaultive or coercive behavior, which we'll go over, but it has a lot of the same things as DV does. And if we talk about the legal definition, these types of behaviors are perpetrated by someone who is, was, or wishes to be involved in an intimate or dating relationship with an adult or adolescent. And it really is about establishing control, which we'll discuss. But then people ask, what's the difference between DV and IPV? So we find that all IPV is DV, not all DV is IPV. But we really want to think about the who. So we're going to be focusing a lot on intimate partner violence, which includes like a kind of like a romantic relationship. So we're going to take those relationships from before and add that romantic component. So dating or have dated, have a child in common if previously in a romantic relationship, and spouses, former spouses. And this is really going to add to that layer of dynamic within power and control and these relationships. So two more having to do with domestic violence is primary aggressor and women who use force. I just want to bring this up because we may use this terminology, and this is something, especially within the LGBTQ plus community, that adds a layer to, or I should say a barrier to sometimes accessing services. One example is our legal system is set up very heteronormative. So it's set up to use language of the binary. We have typically a cisgender male and female who are married. So I just want to go over what these terms mean, but it doesn't always look like that. It can be in any kind of relationship, and these terms can be used interchangeably with that. So we have primary aggressor and women who use force. So instead of explaining it, I'm going to use a little story. So let's say Hannah and I are in a relationship, and I am extremely coercive, manipulative, and sometimes violent with Hannah. Now, let's say one night Hannah has had enough because I've got her against a wall. I am in her face. I am threatening her, and she decides she pushes me. Well, I want the power now. So I'm going to push back and get more aggressive. And Hannah grabs something off the counter and smashes me in the head with it. Okay, well, now I can call 911, right? So I'm calling 911. My girlfriend or my wife just hit me in the head with something and she's being violent with me. So we're going to pause. Unfortunately, we're still working on training for this, but when we look at that, Hannah was a woman who uses force, or somebody who was using force, typically really defending herself against my violence manipulation. So while yes, Hannah hit me over the head to protect herself, I am the primary aggressor or the prime person who is doing the abuse.
Mhm. And some of the motivations for that too is, again, we see it mostly in women, but it's I've had enough. I am using self-defense. Maybe it's retaliation. Maybe I'm angry. Maybe I'm stressed. It can be a lot of different things, but there are some different motivations for women who use force. But most commonly at LACASA, we see they are fed up or they are finally pushing back. Okay, so let's kind of lean into some of our more LGBTQ plus specific definitions. So LGBTQ plus, another alphabet soup acronym, stands for lesbian, gay, bisexual, transgender, queer, questioning. And then the plus sign is used as kind of an inclusive marker. We know that there are many other identities and orientations and people who are included in this community. Today, we may say LGB, LGBT, LGBTQ or Q+. And this is kind of a shorthand that we use, but please know that we are also including all their identities, especially within this community, in our language. Cisgender is another term that we will end up using quite a bit. Basically, it means somebody who identifies with the sex that they were assigned at birth. So for example, when I was born, the doctor said, it's a girl. And I still identify with that. Based on my sex assigned at birth, I feel like that is true of me and true for me. And then the next one would be passing. Passing is, I like to think of it kind of like a chameleon a little bit. It refers to somebody's ability to blend in or avoid specific identification of their identity. This can be good, this can be bad, it depends. But when we think of it in race or gender, race or ethnicity, it can mean they maybe look more one way or another, or less one way or another. Within the LGBT community, it might be somebody who is gay, but maybe they don't look gay, whatever gay is supposed to be. I know for a lot of gay women, they might look very feminine, or for gay men, they might look very masculine, but it's kind of a way that they can slide through without people identifying exactly who they are. Or with a transgender individual, someone might read them as the gender that they identify with versus the one that they were assigned at birth. So it's kind of an easy way of blending in. Next ones we're going to talk about are in the closet. This is a little bit of a casual phrase that's used to indicate someone who is not necessarily open about their identity or orientation. There are varying degrees of being in the closet. For example, a person can be out in their friend group or their social life, but they might be in the closet at work or with their family. Similarly, coming out refers to a process where somebody is able to kind of accept and share their identity or orientation. There are varying degrees here too, but on the opposite side, the other side, somebody could be outed, where that information is shared by someone else without their permission. This can be really invasive, scary, and kind of violating for that person. But coming out is a big process for many LGBTQ plus folks, and not everyone does. And then the final one that I want to talk about, or not the final one, almost final one, behind closed doors, another casual phrase used to talk about what happens, kind of like what happens in Vegas stays in Vegas, but what happens at home or what happens out of sight stays a secret. And with these definitions in particular, we're going to be talking about a double closeted aspect of DV, domestic violence, IPV, interpersonal violence within the LGBT community. This could mean for someone in the community, there may be various pieces of information that are kept a secret. Maybe they are gay, maybe they are experiencing abuse, and maybe the person who's abusing them is also gay. If they share one of these elements, it may automatically communicate these other ones. And so that can be an added layer of difficulty for that person in getting help and service. All right, last two. Safe spaces are spaces which intentionally work to affirm and support LGBTQ plus folks. Although we can never ensure a space is going to be safe or affirming 100% of the time, a safe place is a space, group, community that is intentionally working to affirm these people. There is no such thing necessarily as a safe space. We know even spaces that intend to be aren't always, but really they are spaces that are working toward that. Instead of thinking of safe spaces, I like to think of it as brave spaces, spaces where it encourages folks to be a little bit more brave, a little bit more authentic, whatever that might mean. And then finally, safety. We're going to be talking about safety in a variety of settings and in a variety of ways. But when we're thinking about this, especially for LGBT folks, it might include their physical safety, like my physical well-being. Am I safe from assault or harassment if I go to the grocery store? But it also might be emotional or needs-based. Like if I tell somebody, are they going to harass me? Am I going to lose that relationship? Are my emotions going to be safe after that information is shared or found out? Or if someone finds out or I share this information, will I lose my job? Will I lose my housing? And this is a reality in many of our states still, unfortunately. Or finally, if I do come out publicly with maybe the abuse I'm facing in a relationship, will my community reject me? So safety has a lot of different layers that we will be talking about. So now that we've gotten some definitions out of the way, let's dive into some dynamics that we see of abuse within the LGBTQ community, within LGBTQ relationships, and then also dynamics that the community as a whole may experience.
Yes, and so while we're going to be specific, I am going to actually do a very, very quick, just brush through of typical domestic violence dynamics that we see across the board. So we're also going to discuss that, and then we'll discuss the layers that come from being part of the community. So first off, power and control. Power and control, people say, why do people abuse? Power and control. And what this means is, how can I get power over you to get you to do pretty much what I want you to do when, however I want you to do it? How can I have full control over your life? And as you see in the picture, sometimes while the door may seem open, some survivors are not able to gracefully or safely walk through that door. So keep power and control at the forefront of your mind as we go through some of these dynamics. Now, what you're seeing here, this is the power and control wheel, and it's used to describe all different tactics that people use when they're using controlling behavior. But something very specific to the LGBTQ plus community is on top of all of these dynamics, we also have societal dynamics that are used even by people within the community to further abuse or isolate or really get what they want from their partner. So I am going to, like I said, briefly go through some of these dynamics, and then we're going to go a little more in depth into specifically the LGBTQ plus community. So I'm going to start with using intimidation. So I want to remind everyone, when it comes to intimidation, sometimes people just think you got a big burly guy who's like physically abusing their small female partner, but that's not always intimidation. The intimidation looks a lot of different ways, not just physical. It could be yelling, stalking, maybe driving recklessly. And I have bolded points here that are specific to the LGBTQ plus community, which we will cover, but using homophobia to prevent you from talking about the abuse. Also with using intimidation, it's going to be also threats, but that intimidation and threat of, I can pass. Are you really safe? Can you really leave the house okay? And Hannah will discuss that a little bit more in a little bit. We also have using privilege. So Nicole had discussed privilege before we began, but this can be seen, sometimes people think that with LGBTQ members, it has to just be like a relationship that may involve two women or two men. But let's say we have a woman who identifies as bi, or maybe identifies as gender, maybe somebody identifies as gender nonconforming, but they also identify as straight or bisexual. Sometimes defining what those gender roles are can be extremely harmful and kind of, I'm going to say, put someone in their place when we're talking about power and control. Really have that feeling of being trapped in a certain box when you're trying to be authentically yourself, which puts us right into emotional abuse. So we have the making you feel guilty or bad about your sexual orientation. We're going to talk about what gaslighting may look like, but name calling, giving gifts and making promises after an incident happens, or humiliating you, negatively comparing you to others. And we are going to see that emotional abuse happening, especially we see within the community itself. So somebody threatening that, oh, well, our friends who love and accept you, you really think they're going to love and accept you after they find out that you fill in the blank. So that can be a really big threat, especially if that's the only group that you are out to. If that's the only group that you're really safe in, it's just another layer of safety being essentially manipulated. Then we have blame, denial, and minimization. So accusing you of mutual abuse or being the instigator, pretending to be the victim. We also know that because of, and just statistically speaking, people who are part of the LGBTQ plus community sometimes have a higher rate of drug and alcohol abuse because of trauma and coping. Different people use different coping skills and coping mechanisms. But we want to mention that no matter what somebody is using, not using, coping with, using it as an excuse for the violence is never okay. And that is a tactic we see often as well, making things seem like they're not that big of a deal. Hannah, would you like to add anything?
Yeah, I think just what we know about statistics is there's a higher rate of abusing substances, and it can be due to trauma, it can be due to stress. I mean, from what we understand, it can be scary to exist in a world that doesn't look like you. But again, yeah, the choice, there's a choice to be abusive or not. And we see this from within the community, within relationships, and then also outside the community directed to LGBT people.
Thanks. Okay, so in using children, while yes, encouraging the children to verbally, physically abuse you, using them to relay inappropriate messages, or even abusing children, we're going to talk about how threatening to take children away is actually set up by some laws that we have in place that directly work against especially same-sex couples. Economic abuse or disparity, making you ask for money, maybe not letting you work, keeping you from a job. And that goes directly again with those, maybe you are the homemaker, the person taking that responsibility. Don't worry about it, I'll take care of you. You don't have to work, you can just stay home. But then turning and using that as a dynamic so that you are now unable to, or they make it seem as though you are unable to now support yourself. Those coercion and threats, that's going to be one of the largest ones we're going to talk about, is what that might look like, whether it's threatening to leave you or threatening to harm themselves, threatening to hurt you or loved one or a pet. We know that a lot of people may have children, but they also may have fur babies, and fur babies for some may be the only babies they have, and that can be extremely detrimental. And then finally, using isolation. And within the LGBTQ plus community, I have almost all of these bolded because this is huge. This is a huge dynamic that really needs to be discussed. So just going through this sabotaging your relationships, using jealousy or concern to justify action. So maybe a partner is, maybe you just came out to your partner as, actually, I am bisexual, or let's even say pansexual. And coming back with, well, then I don't want you hanging out with anybody, because how do I know you're not going to just cheat on me with everyone, just further isolating someone. And another barrier just to accessing services, saying that no one will provide assistance to you because of who you are and how you identify. So I went through some of these very briefly. I just wanted to put them up on the screen so that they were here. You can always reflect back on them when it comes to power and control in relationships in general, but I really want to focus on the LGBTQ+ community. So Hannah, can you go ahead and take this?
Yeah, so let's talk through a couple specific examples of what some of these might look like. We talked about what passing means, but if one partner is more passing than the other, one maybe looks less gay, less something, this information could be used to isolate somebody. Well, you stay home, I'm going to go to the store, I'm going to go to the bank, I'm going to go do these things. I don't want people to harass you because they're going to know. I don't want them to do this. And this will keep a partner maybe isolated or separate from their connections or other resources, right? The second one is laws. We know that over the course of history, there have been some laws in place that have been detrimental for a lot of LGBT folks. We also know that laws do change, which is good. But for example, let's say we have maybe a lesbian couple. Perhaps they've decided to have children. One of the women has decided to carry the child. They perhaps had a sperm donor. In a situation with IPV, we might say perhaps a partner who carried the child may threaten to take that kiddo away from the other partner, or might fight for sole custody or say, well, you won't get sole custody because I carried. It's my kid. You're not really their parent. Could be something like that. And even though a child is on a birth certificate, sometimes laws in different states are set up in ways that make it really difficult for maybe a partner who didn't carry. Using, again, with the laws, we know that there are a lot of laws in place to protect LGBTQ folks, but not all states have that. Outing someone or sharing information about that person without their permission could cause someone to lose their housing in many states, lose their job, or perhaps relationships. We know, I think in Michigan recently, in the last few years, they put laws in place to protect people that they could not be fired for being gay. But that was just in the last few years that has changed. So knowing that outing somebody could really be detrimental. And again, like Kayla mentioned, if I threaten to out somebody, a person, a partner, whatever that might be, they might lose that community or that relationship. Gaslighting can be used in a lot of abusive situations. We may see this as a partner, somebody else denying that abuse can happen within LGBTQ+ relationships. Because like, after all, stereotypes say domestic violence is between a man and a woman. And so no one will believe you. Or, what do you mean I'm abusing you? Like, this isn't happening. You're crazy. You're making this up. It's not possible. And kind of making that person doubt whether this is actually happening or not. And finally, guilt. Guilt and kind of emotional abuse can kind of go together. Within this community, many issues or problems can and are kept quiet or closeted due to fear of further violence, harassment, negative stigma for that individual, those associated, or that community as a whole. Not all airtime is good. When something isn't explicitly positive and it makes the news or big headlines, it can cause more fear, more harassment, more safety concerns for the community as a whole. If you kind of think about in September, there was a lesbian couple that was murdered in a campground out west. And when we have negative messages coming through the media or stereotypes that continue to be shared and believed, it can cause people to act out more violently toward these people and target them. And that's not okay. So we know within the community, sometimes keeping these things quiet is preferred, just so that there's not more risk of fear, violence, etc.
Mm-hmm. And to speak to that too, Hannah, that's why thank you everyone for being here or watching this, because the more information and knowledge we have, the more we'll be able to speak out about it without allowing abusers to use that as an excuse to keep somebody quiet. All right, so specifically trans abuse in relationships, this is an important dynamic to cover. We have using offensive or incorrect pronouns, such as it, to refer to their partner, maybe ridiculing their body, appearance, or their presentation, how they present. Telling them that they're not a real man or real woman. With the intersection of sexual orientation and gender and expression and romantic versus sexual, everything being essentially separate, ridiculing other part of their partner's identities as well. That can come into play, especially with that emotional abuse. And then denying their partner's access to medical treatment, hormones, or coercing them away from medical treatment. And Hannah is going to kind of piggyback off of that medical treatment with an issue that is seen when we are discussing intimate partner violence in the LGBTQ plus community.
Yeah, so another acknowledgement, we know that not all medical settings have adequate training on how to best serve LGBTQ folks. We know that from surveys that have been conducted and studies and whatnot, a lot of it's due to a lack of training. But when it comes to this, one of the big things that we see is folks who do have HIV or AIDS and a positive diagnosis. One of the things is throughout history, HIV and AIDS has been focused on more often than not as a disease that affects the gay community. And does the LGBTQ community have positive cases? Yes. Do other communities also have positive cases? Yes. However, history at times, unfortunately, has really focused on it as being a gay issue, which has gone to further stigmatize and demonize this community and kind of isolate them in a sense. Someone's positive status could be used against them. This could be used in a way to like either mistreatment from others. It could be used as a way to say, no one will love you. You should not leave me. No one will date you or marry you or be around you because you're positive. So I'm your only option. It could be used to isolate somebody. It could be used as kind of blackmail too. If I know that somebody is positive, maybe I threaten to out them about that, whether they're gay or not, saying, hey, if you don't do what I want, I might share this. Or you could see if somebody is positive, threatening to leave them. Maybe they are, maybe it was caught a little bit later on and they've not been able to keep their levels low. We have seen that maybe one partner will say, well, if you leave me, no one's going to take care of you when you really get sick. Or on the flip side, if you leave me, no one will take care of me and it'll be your fault if I die. A lot more emotional stuff. And finally, with that piece, if somebody is positive, it might be a reason an abusive partner might say, well, you're going to get sick anyway, so let's put all of the accounts in the house in my name because I'm going to have to take care of it anyways. And that further just takes one more level of autonomy or an escape route away from somebody. Finally, and we kind of talked about this a little bit, there's just that emotional side. It could threaten like, well, you might be positive now, you might not. Again, I might be your only option. And it just kind of keeps somebody there. It can kind of be scary for somebody if they are positive to know, what do I do? Or am I positive? Was I infected? Was I not? What are my options? Is this going to be the end of the line for me? Thankfully, medicine and science are far enough along that many people who are positive are able to get treatment and live long, healthy, wonderful, fulfilling lives, even if they do have a positive diagnosis. But these are a few things about another dynamic that folks in the LGBT community might be faced with as other layers of complication. We're going to kind of move into this next question is if violence in the home is so bad, why would somebody choose to stay? If it's really gotten this bad and there's so many other things, why would somebody choose to stay in a relationship like that? So what we are going to do is have you break out into some breakout groups. We're probably going to give it a couple of minutes. We'll let you know when to come back, but I'd like you to discuss what are some barriers to leaving an abusive relationship for an LGBTQ plus individual. It could be a same-sex couple, 2 gay men, 2 gay women. It could be one partner and maybe one is trans. It could be a straight partner and a partner who is bi or pan or something like that. But what were some barriers that a person may experience in trying to leave a relationship? So Nicole, would you mind helping us break out? We're going to come back and discuss it in a few minutes. But
So make sure you have, a representative to come back and kind of discuss what your group had talked about. And feel free to leave your camera off if you want to, but we just wanted to promote a little bit of discussion.
All right, and Nicole,
I'm getting those assigned. Give me just one more minute here.
Thank you.
Frank, I don't know you, but your picture, your still picture that you have, every time I look at it, made me smile the whole time. It's a super happy picture.
Thank you.
You're welcome.
All right, you're being sent to your rooms.
All right, it looks like Frank has your hand.
Can you say that one more time, Kayla?
Frank has the hand raised, so we'll start
fabulous.
with Frank.
I was part of team 2, and we discussed like income, the systems of like police, healthcare, other social services, like who can you trust, the ability of someone's a florist and they're well known in the town, and that cutoff of income, and also if you give out your information to one person and you have to go find another person, that kind of makes it more wide known that you are who you are. I like someone mentioned that you have to have a lot of self-esteem to even break away from anything in this world. And also there was a comment about if from me about if you gain a little bit of like connections with that family or friends in that circle, you lose that connections.
Yeah, very good. A lot of fear of what's going to happen to, my finances. Do we have joint finances? Do we have separate? What's going to happen if I found a service provider who works for me? Am I going to lose that? What happens if people find out who I am? Especially if they're maybe not out across the board. Yeah.
And in discussing, oh, sorry, go ahead.
May I add, if any of part of my group has something that I missed, will they please speak up? Thank you.
You did a nice job, Frank.
Thank you.
And
And I would love to speak specifically, Frank, you had brought up if someone is well known in the community. Livingston County in particular is a very much everyone knows everyone community. And so people might think, oh, well, that may be more of a safe haven, but unfortunately that can add more levels of danger to leaving and with the dynamics that we have discussed. So thank you, Team 2, for bringing that to everyone's attention.
Yeah.
All right.
What else? Did
What
group,
else did I-
group 1 or 4, I believe? We group 3 got a little bit small, and so we joined them.
I can go.
Thank you.
I think I was group 4. I guess I didn't really pay attention, but I think I was 4. So we kind of talked about some of the similar things, but we, kind of discussed finances. We talked about kind of the fear of just the unknown in general. Also that the individual may actually have internalized and believe what their partner told them about, like, if you leave, like, nobody else is going to want you, no one else is going to love you, that sort of thing. Also talked about like a lack of support system. And so maybe that individual, they, when they came out to their family and friends, they no longer accepted them. And so it's kind of like, well, if I leave here, who else can I go to? Also maybe that fear of kind of going to a shelter. And, if I'm trans, like, will they accept me? Or, even if I'm gay or lesbian, all of those, will I be accepted for me? Or kind of what will that look like? Again, kind of tied back into that fear of the unknown and, well, what could I expect? So that were kind of the main things that we had talked about.
That's great. That's super great.
Yeah, pulling it back to the what ifs. The what ifs are so make it so difficult, that unknown. And then if you're manipulated and just told constantly, consistently, over and over again, going back to what Frank said, that self-esteem portion, trying to build yourself up to feel that confidence, and then being constantly broke down by the person trying to gain that power and control back over you. It's can be intense. I also wanted to bring up the point you said, no one else will love you, and will they help me? We're going to go over the will they help me in our next section. Will that agency help me? Are they going to be friendly? Maybe they have a rainbow sticker on their door, but do they really practice safe behavior?
You also mentioned something about kind of the what's going to happen to me if they know my orientation. Do they also know my identity? And there might be different layers. So you could have, I don't know, somebody who identifies as a lesbian, but maybe who's also transgender. And maybe their partner is the only one who knows that. Maybe finding somebody else that they feel would embrace them, either in a relationship or in a community. That can be scary. They might feel very isolated in that self-esteem part. What we know from working with survivors is that takes a long time to rebuild. Yeah, very, very good. Let's see, what about our last group 1 or 4, whichever number it was?
What group was I in?
Were you
I think you were in 1.
Oh, did we already go?
We'd be
Go
happy
ahead,
to hear.
Nicole.
Yeah.
No, you guys go right ahead. I just wanted to make sure you guys said something if you wanted to. I always talk, so it's fine. I just wanted to say that being in a high school and seeing students who maybe have come out or haven't come out and are creating relationships, and they're already isolated, and then from maybe family members or friends, and then they get involved in relationships. It's so quickly, so fast, where I see more of emotional abuse going on, that makes such a direct impact, and developmentally they're still so vulnerable that's where from my perspective, that I struggle with such of the negative impact on the individuals, and the control and the gaslighting and the emotional abuse. It's already hard to come and talk in general, but the compact of the whole dynamic with the abuse and being LGBTQ and isolated and all of these other things is just very scary, and I'm just having a difficult time with it myself, with how to even help on some level sometimes.
There's a couple of things that you pointed out, and I'm really happy you did. I know, especially with like the adolescents, my job position specifically is I work with teens. And we do see sometimes they move very fast. Maybe they finally come out and they finally feel this, I'm out, I'm here. Maybe the first person who accepts them, they might kind of cling on to, especially with adolescents. And one of the things that is now starting to really come to the forefront is so many of the positive examples of happy, healthy, successful LGBT individuals and couples may not be very present. I know for a lot of the teens I've worked with, they don't know anybody over 30 who is in the community. They might not know that there is hope for them to be successful, to have a happy relationship. So the first one that comes along might be what feels to them like their only option. That's why representation is so important and so critical, because also we think generationally, and like as time has gone on, it's safer now for people to come out maybe in the workplace, but even 10 years ago, it would not be safe. So these positive examples that maybe the kids would like to see, they're not seeing necessarily. And also something with our presentation is we do not intend to paint that all LGBT couples are going to struggle with this. We know that there are so many very happy, healthy, successful, and thriving relationships within this community that are absolutely beautiful. But we're hoping that by pointing some of this stuff out, maybe as allies, as community members, we can continue to support those healthy things and those good things, and maybe remind those students that we're seeing that maybe they are kind of in an emotionally abusive or controlling relationship, that hey, there are better options and there's hope.
And just,
yeah,
Hannah, I'd love to piggyback off of that. I have been working with Nicole Shinjek for a long time, it seems like, and you just, I mean, on the money. The students that we see, we've been providing support groups. Darn COVID, but doing support groups with your school for quite a while. And that's exactly what we see. And it's hard because, especially, I'm not sure about out of county schools, but working in the Livingston County high schools for so long, there's usually a smaller LGBTQ plus community within the school, and which also means smaller dating pool. So they don't have as many people that they can kind of, our students have that kind of freedom to kind of test out relationships, do different things. But when your dating pool or your community is so small, that just further adds that isolation. And then who do you go to for help? It can be really difficult. Now, I will say, Nicole, not to just, I'm not blowing smoke, I promise. You make it very clear that you're accepting and welcoming at your school, but sometimes students don't always know that about their support staff. So it can be difficult as well. Thank you for bringing up adolescents and teens, because that is a hugely underrepresented community when we're talking about abuse. Mm-hmm.
Yeah.
All right. So before, we're going to kind of breeze through the next slides to make sure we have some time for Q&A. So Hannah and I are going to go pretty quickly. And then, yes, hopefully we can open it up for anybody who has any questions.
Thank you, everybody. Those are some fabulous answers. We are the themes that we're seeing are isolation, some fears about what ifs, what's going to happen to me, what will happen to my partner, finances. Am I going to be loved? Am I going to be able to love? Maybe they really care about that partner, and maybe that dating pool is very small. What's my community going to say? A lot of that. So we see fear and love as really a lot of those foundational pieces that many folks within dating violence, IPV, domestic violence, that they might see those things. So very good answers. Thank you, everybody, for sharing.
Mm-hmm. And these are going to directly go into our next topic, and we're going to talk about some systemic barriers and community impact. So I'm going to pull up some statistics. Now, there are differing statistics when it comes to the LGBTQ plus community. We are going to use the CDC because they did the most recent study. So we're going to use the CDC across our stats. So we see that this happens often. This is just general. So this isn't necessarily LGBTQ plus, but in general, about 1 in 5 women and 1 in 7 men experience severe physical violence. 1 in 5 women, 1 in 12 men experience contact sexual violence, but that's in an intimate partner relationship. And that 10% of women and 2% of men report having been stalked by an intimate partner. Now, when it comes to the LGBTQ plus community, we're going to see some differences. So, and this is across the board, those who identify as bisexual, and you're going to see this with men too, experience much higher rates of violence. But we also see, so we have straight women 35% and lesbians 44%. When it comes to gay men, we have 26% of gay men, 29% of heterosexual men, but then again, that higher rate, that higher level, 37% of bisexual men. And that kind of all comes down to this slide. And this is really important to talk about. And that is like perpetration and gender. So we see that with these statistics, a lot of extreme violence is happening by cisgender straight males. This is both in studies, what we've seen working in the profession. So we have almost 90% of bisexual women reported only male perpetrators of intimate partner violence when it comes to extreme like physical violence, rape, or stalking. And almost a third of lesbian women who have experienced such incidents had 1 or more male perpetrators. And we see that in the form of not only in relationships, but also things such as corrective rape or murder. We're seeing that happening a lot more with men, but that's not, doesn't go to say that perpetrators of abuse or those who are using abusive behavior can't be women or can't be those within the LGBTQ plus community. But we did want to acknowledge that there are much higher numbers, which puts people in an even more vulnerable position when it comes to abuse.
And again, this isn't just within like a same-sex relationship. It could be, like Kayla's mentioned, maybe like a bisexual or pansexual woman and a straight man in a relationship like that. Those numbers are also included because one of the partners is in the community. Yeah, wow. Okay. Those stats always make me just, my heart ache. Okay, so as we talk, we're moving into these systemic barrier type things. Let's talk about what would happen if things maybe get bad enough in a situation that emergency services are contacted. Let's say, for example, we have a gay couple, 2 men. There's domestic going on, but there's also the interpersonal violence. Things get bad, like so bad one day that one of the partners does call 911. Let's say law enforcement and an ambulance show up. Some of the things that might be tricky there is not all of the emergency professionals on the scene or who have helped with the call may have adequate training in this. They may use the wrong pronouns. They may have some preconceived assumptions that could further negatively impact the survivor or interfere with them getting help. For instance, and kind of with this second point, 911 calls, if I'm a man saying, hey, my partner is abusing me. Oh, what is she doing? Well, actually it's he. Okay, so it's not domestic violence, it's just some sort of an assault. Is it a neighbor? There might be a lack of understanding, which is going to complicate the process, and it's a little bit more, it's already vulnerable for them to share that this is going on, and then to make it, no, I have to continue informing these people what's going on and how vulnerable is that for me. So you have that. Most definitions legally, maybe not most, but historically, a lot of them have been written with heteronormative language. Stereotypes, not always correct, a male perpetrator, a female victim, right? If there's 2, let's say, for instance, if there's again, the two men, if it's coded as just like an assault and not domestic violence or IPV, that could limit the services or support that person might receive. Finally, we might see with like homophobia. A survivor might kind of experience microaggressions or bias based on the service provider that they see. Let's say, again, two men, IPV, maybe one of them was sexually assaulted too. They're talking to the EMT saying, hey, this is what happened. And no, he's not my neighbor. No, he's not my roommate. He's my spouse, or he's my partner, and I was raped. That service provider may have some sort of reaction and could potentially treat that person differently, or there could be some aggressions or just lack of support. And unfortunately, due to the history of these kind of things, many folks in the LGBT community don't seek support or don't seek services because it can be scary, or the emotional toll that they might have to experience to educate somebody might not be worth it for them. Maybe because there's just layer on layer on layer. So these are some of the barriers to emergency services. Kayla's gonna start looking at available and safe resources.
Yeah, so available and safe resources, those who are providing help. Some of these are going to be similar on the next slide as well. So I'm going to just kind of brush through these. There can be of the belief that domestic violence doesn't happen in LGBTQ plus relationships. Also, and this was brought up when we talked about why it might be difficult to leave, but some shelters historically, domestic violence shelters are typically cisgender women only and their children. And that's who they help. At LACASA, we will help all. I will just use the brush term of all. And we have different, I should say, policies and protocols and even rooms in our shelter set aside to ensure that we're able to accommodate everyone to the best of our ability within our capacity. So that's really exciting for LACASA, but not all are safe in that way. I mean, lack of training surrounding this specific issue, LGBTQ plus, IPV, and safety when it comes to domestic violence, even when I know I've been working in this field for quite a while. And so this is one of my areas of specialty, and Hannah as well, but I was looking for just some statistics and general information just to make sure everything was up to date and in line. And I was baffled. I was like, Hannah, there's nothing, or very limited, or everything says the same thing,
Or it's hard to
or this is the same information that I saw 7 years ago, 8 years ago. And so I think the specialized training around this issue, really, there haven't been a lot of studies. It's really important that people are receiving training specialized in this information. And then we have potential homophobia from service provider staff, but also we have to take into consideration non-LGBT survivors. So if somebody is in the shelter with somebody who maybe homophobic, or if somebody's in a support group with somebody who maybe doesn't accept them for who they are, that just adds another layer of that oppression and really abuse. And then I have intentional or unintentional outing by service providers. So I always just say, be really careful with notes, be really careful and ask for permission in what things are being documented, because when it comes to domestic violence, some of the time the courts are involved. You might have subpoenas for information. You might have cross systems. If there's children involved, now you might have some kind of investigation against one parent. And we don't want to and sometimes it's unintentional. Somebody may have the best intention in working with somebody who's part of the LGBTQ plus community, but just even as something as simple as report writing, we have to be careful that we're not unintentionally outing somebody or placing them at greater risk. And then finally, community and training and equity. So many of these are the same, so I'll just do a couple ones that are different. But I have on here the research involving these populations. There's not very much research to be able to provide these programs, so we're basing it off of, unfortunately, and relying on those who have experienced the violence within the LGBTQ community to educate others about their community, which can be a beautiful thing, but also that's a lot of burden. And those looking for the information have a lot of privilege in that. Just being able to access information in that way. And then going back to what Hannah had brought up before, the fear of airing problems among the LGBTQ population and community, taking away from the progress toward equality, thinking if we talk about this happening, are people going to look at this community differently? And then finally, just as service providers, there can be policies in place, there can be trainings, but just society in general, there can be anti-LGBTQ bias. And so we're going to, I don't know if we'll have much time. We might have to send out the PowerPoint, but we have some slides on how you as a community can support survivors and work together as a team. And that information is going to be some that might be able to push us forward within the movement. All right, so
yeah, we're gonna move into a little bit of what would it look like to support a survivor. It's very similar to supporting any other survivor. However, a lot of it's gonna be kind of recognizing their bravery. Listen, don't take over, understand that it's unique. Your response will have an impact on the survivor. We know a sexual assault, usually the response of the first person can kind of dictate what happens in their case. So keeping these things in mind, but the big thing again is just knowing that disclosing any information that's personal, especially if it has to do with violence or identity, is very private and very vulnerable. For an LGBTQ plus survivor, this might be exponentially more sensitive and tender. One of the big things that I love on this is thank you for trusting me with this. Well, you're very brave for sharing that. And I'm here to support you, kind of letting them lead the conversation. As far as we're going to kind of keep moving, tips for speaking with survivor. There's some things that we can, one more forward, Kayla. There's some things that we can say, but there's some other things that maybe it's better to leave out. Kayla, do you want to touch on any of these?
Oh, just, yes, avoiding, I mean, why questions? Why did this happen? Why did you do this or that? That can place blame on somebody for the situation that they're in. Asking questions based in curiosity and allowing some, like making sure that you're allowing them to share what they want when they're comfortable. And then be mindful when providing resources or suggestions to receiving help, and especially on-hand materials and resources, and the safety of what, like me handing you 20 things about LACASA might not be safe to bring that home. So just being mindful in that, because it can be really intimidating and difficult to even consider starting this process. And you all came up with some great reasons why it can be difficult to leave and or start this process. So it's really important to provide helpful support resources. I have normalization, not that abuse is normal, but letting people know they're not alone, and really truly listening to them. Up on the screen, I won't go through all of these, but just some helpful phrases that you can use to just, again, validate and let them know that it's not their fault, that you believe them, thanking them for trusting you, opening up that brave space, and letting them know that while you're there to support them in their own time and own way. Okay, and then just these couple things, finally tapping into your own thoughts. While sharing your feelings and concerns could be supportive, it could also be overwhelming. So advice and stepping in are not always helpful, and it can really take away that survivor's power. So be mindful of sharing your thoughts.
This also might be the first time you learn that a survivor is in the community. Don't freak out. Just like, okay, process that at a later date. Don't make it the center. I didn't know. Oh my gosh, I would have never guessed. Or I knew. Don't add that. That's gonna just be worse for the survivor in that moment. So keeping those thoughts, acknowledging them, but keep going.
Yeah, and also taking care of yourself, because I mean, you may find a similarity to the survivor story as something that happened with you. I mean, if you love someone and you're finding out that they're being hurt, it can be so so hard to handle that. So remember, we always say the airplane with the face mask. Put on your own oxygen mask before you help anybody. Make sure that you're prepared and ready and have the space.
Mhm.
So we have, oh, sorry. I was going to say we could send this out kind of more in like a worksheet format. If Nicole, you would like to share that with participants. Hannah, is there anything specifically you'd like to add to the section on working as a team and as a community or agency?
Just that as allies, we can make a difference for survivors among us, but also LGBT folks or any other intersection of identity by asking questions, by finding ways to, is this resource actually friendly? If I have a friend, maybe my capacity is at LACASA, but maybe I'm somebody's neighbor, maybe I'm somebody's sister. What is my role and how can I help better this movement and help support the community as a whole? That's kind of what I would say. Send out some of this information in another format for follow-up. Yeah.
So yeah, and briefly, just some LACASA services. I'll go through these very quickly. If you want any more information, you can always call or text LACASA's helpline. We now have a texting line, and it is fully functional, up and running, excited, or visiting LACASA's website, which is lacasacenter.org. But just some of the services we provide, again, to all. We have shelter. We help people with legal advocacy and walking through the court process. We provide counseling to everyone who may have been impacted, including friends and family as well. We can take care of anyone who has experienced any kind of sexual violence, both in a relationship and outside of that relationship. And we also do many community education and awareness events. So keep a lookout for different ways that LACASA is promoting like, for example, October's Domestic Violence Awareness Month. So trying to bring light and awareness on domestic violence. April is Sexual Assault Awareness Month. So really looking at coming out and supporting those initiatives, bringing more awareness about these issues, and really knowing that this is an agency. We are here to help. We have a lot of initiatives, including our DEI committee, really trying to educate our staff and ensure that we're providing services in a safe way.
Yeah, I think one last final thing, these are some national and local resources. These are some general facts about LACASA, but each area in our agency, we worked to make sure that it is ideally, hopefully safe and create brave spaces, whether it's making sure that we have private individual dressing rooms at our store so that maybe someone who's maybe gender not conforming can feel a little bit safer trying on clothing, whether it's in our shelter, maybe somebody is transitioning. We have private rooms if they would prefer a private room. If it's calling our helpline, knowing that people are going to respect your pronouns. If it's working in a court system, we can make sure that your victim statement is true to you. Or if it's during a sexual assault nurse exam, that it is not available just for women and girls, but it can be anybody of any gender who's been experiencing this stuff. So I think that's all that I've got to add. Kayla, anything else before maybe we take questions?
No, I figured we might have time for a couple questions. And then Nicole, I know you have a couple housekeeping items you have. We just breezed through the end. It is such a large, in-depth topic.
It is massive and it's really hard to get through everything, but I appreciate you guys trying to get through everything all together. For folks, if you want to send your email in a private chat to me, you're more than welcome to do that. If you need to rush off, Kayla, can you stop doing the screen share? I'm going to hop on real quick here and then I can share the evaluation link in the chat for folks. Great. Thank you so much. All right, so we're going to switch this around here. Oh, and of course I went too fast. So now we got to go back for a second here. All right. So I'm going to throw this link in the chat here so y'all can do that. While I'm messing around and not being fully functional here, any questions for either Kayla or Hannah?
No questions here. You guys are just all rock stars. That's all I can say. You guys are awesome.
I have a question. Do you guys know if that new 211 dialing number is ready for LGBTQ? I mean, because it's for like human services and suicide, and do you know if that's a safe place for young adults if they're having trouble? I mean, are they trained in it?
So great question. I do not know the answer to that personally. However, that's a great question to ask. If there's some sort of partnership that you might have with any members there, it's a great question to ask, because sometimes we have stickers on doors that say we're friendly, but not all agencies are or are equipped for that. They might say, yeah, we won't like punch somebody if they walk in the door, but they might not know that pronouns are important. They might not know that not all resources are safe or friendly or sharing the information. I don't know if Kayla or Nicole, you know that, but I would love to look into that and find out more.
I was just going to jump in and say, if you're not sure, which we are not sure, we can't speak to any other organization or helpline, but something that we skipped over quickly was, don't be afraid to ask the hard questions. Ask the hard questions to your agencies. And if they don't know, hopefully they look to find out. And if they don't, then you kind of get your answer there.
I think that's one of those things too, is that you can kind of be an advocate, even if that person is in the community or if they're an ally. I remember I worked in churches previously, and it was a question to a lot of the staff I worked with, is what ways are we making our church a safe place for people to come authentically? And what are you doing? What if this person wants to teach Sunday school? What if this person wants to volunteer? What if? And asking those questions can make a difference, because A, you get them thinking, and C, you might have a resource afterwards. That's a good question. I'm going to look into that and see if we can find any information about that for the future.
Is fantastic information. And I think that, what was mentioned is really, really true, that, people can have, our All Are Welcome cling displayed, which you now see on your screen. That's from Pride Alliance Livingston, that was created last year. We do ask that businesses or organizations that display the cling agree to our social agreement, and to ensure that they are willing to disrupt harassment and hate language, and just making sure that people do feel welcome, that they do have some skin in the game by displaying that cling. And I have actually been able to follow up with one business who we heard that they weren't necessarily following through on that agreement, and had some conversations with their staff. So, there are some training opportunities that we can provide as Pride Alliance of Livingston and Livingston Diversity Council for our businesses. Those will be much more publicly marketed next year, starting in 2022. So, but in the meantime, there's definitely some things to do to stay engaged with folks. Making sure that you're staying on social media will obviously help you to know exactly what's happening. You can join us next month for our November Learn Love Livingston session on November 17th, which is the third Wednesday of the month. We are actually going to be featuring a speaker from the Zebra Wing Center up in Mount Pleasant, Michigan. And they will be talking to us about the Anishinaabe spirituality for our Native American Heritage Month. So we're really, really excited about that. You can also check out again our YouTube channel, Livingston Diversity Council, and see all of our previous sessions. So feel free to keep us in mind if you need anything. My contact information is on there. Again, please fill out the survey. If you want more information, send your emails into the survey, or you can throw them in the chat real quick. I'll make sure to be able to send you out any additional information. But again, I thank you for being a part of our October Learn Love Livingston today. And I wish you all well in your journeys toward diversity, equity, inclusion, and access for all of our community. So thank you.
Thank you everyone for attending. We're so happy that you were here. I hear a puppy.